HPV is called the human papillomavirus. It's a very common virus. There's over 100 different strains of this virus. Some strains can cause things like genital warts, and some can cause changes to the cells of the cervix that can lead to cervical cancer. So we do different types of screening tests. So the most common screening test is something called a Pap smear. So every time you come in for the clinic and have a Pap smear done, we use an instrument called a speculum, place that inside of the vagina, and then use a swab. And we actually swab the opening of the cervix, which is called the cervical os right here. And then we use the swab to take samples of the cells of the cervix and send it to the lab to evaluate for changes and possibly for HPV. It's a really helpful tool that we have to detect changes to the cells of the cervix that can lead to cervical cancer, and we can help prevent changes from turning into cervical cancer. Another helpful thing is the HPV vaccine, which can also significantly decrease rates of cervical changes and cervical cancer. So HPV vaccines are given between the ages of 9 and 26, and the Pap smear screening begins at age 21. Together, Central Health and Community Care are dedicated to providing healthcare access to all. Señora, ¿está lista?